Relapsing polychondritis. Relapsing means recurring again and again. Chondritis means inflammation of the cartilage. Poly means more than two. So, in short, there is inflammation of the cartilage in the body, more than 2 or 3 cartilages in the body, and it is recurring again and again. That is the word meaning of the title. Now, let me give a small introduction. This is an autoimmune disorder. Means every person, they have a protective mechanism in the body, that is the immune system. So if there is any foreign material which tries to enter the body, like a bacteria, virus, allergy, any sort of material which tries to enter the body, this immune system gets activated and it tries to destroy whatever is entering the body. In this condition, there is an autoimmune disorder. So what happens is, the autoimmune system gets activated not when any foreign material enters the body. It recognizes the body's own cartilage or any other system as a foreign body. In this condition, it's the cartilage. So the autoimmune system recognizes the cartilages in the body as a foreign material and it starts attacking the cartilage. So initially, the patient will have pain in the place of the cartilage. And what happens because of recurrent inflammation of the cartilage? It destroys the cartilage. And this is commonly seen at between the age of 35 to 45. And this is an autoimmune disorder. Same person will be having more than 2 or 3 autoimmune disorders together. The other, to name a few, are systemic vasculitis, rheumatoid arthritis, and systemic lupus erythematosus. There are so many other autoimmune diseases. So the person can have more than 2 or 3 autoimmune disorders and he will be having this relapsing polychondritis too. Now, coming to the presentation, the complaint of the patients. He may say that it will start with mild fever and he feels weak, followed by he will have a swelling of both the ears, and he says he gets severe pain that time. Same time, he will be having pain in the nose too. So on examination, he will be having mild fever, and examination of the eye or the blood test, which shows that he has his blood hemoglobin is less, and he has lost weight too. So examination of the ear shows both the pinna, this part is called the pinna, it is swollen up and it is discolored, and the color will be like brownish red in color. And it will be swollen up, and to touch it will be severe, it will be painful. It's a painful condition. And this is the acute phase, acute attack, one episode. Likewise, he will be having multiple episodes. And finally, when the cartilage is completely destroyed, he ends up with a condition called cauliflower ear, where the shape of the cartilage or the ear is completely changed. Now the same condition, when it happens in the nose, there is a bridge of the nose. The anterior part is cartilage, the posterior part is bone. So the cartilage will be destroyed and it can change the shape of the nose itself. It will result in saddle nose. It will drop down like this. When the same condition affects the sound box, voice box, it leads to breathing difficulty. And same thing happens when the windpipe and trachea and the bronchus are involved. Now, it can affect the eyes too. There you don't have a cartilage, but it affects the arteries there, and the blood supply is altered because of vasculitis. Coming to the investigation, you don't have a single test so that we can do it and we can say this is a case of relapsing polychondritis. But what we can do is, we can do few markers. All these are autoimmune markers, and if suppose it is high, we can say this is autoimmune disorder and maybe this is relapsing polychondritis, because that is also a autoimmune disorder. So if you ask me, is there any single test which can be helpful? Yes, biopsy can be, but it is not very practical. Now, if you do a simple blood test, it shows the hemoglobin is low, and there are 2 other markers, inflammatory markers like ESR and C-reactive protein, both these will be elevated. Now coming to the treatment part. When the patient comes in the acute phase, when he has got severe pain, so we used to give painkillers. Along with that, when we have this clinical diagnosis, we will start with steroid in the full dose. And slowly we will taper it off. and he'll be on a maintenance dose of low steroid for a few months. And to prevent recurrence, one of the best known drug will be dapsone. So this is about relapsing polychondritis. Thank you so much.